हेलो एवरीवन, आशा करता हूँ आप सब लोग अच्छे होंगे। आज फिर हम एक नया टॉपिक डिस्कस करेंगे। इससे पहले भी हमने बहुत से मेडिकल लेक्चर्स जो है इस चैनल पर डाले हुए हैं। अगर आप चैनल पर नए हो तो चैनल को पहले सब्सक्राइब करें, उसके बाद में वीडियो को कंटिन्यू वॉच करें। आज फिर हम एक नया टॉपिक डिस्कस करेंगे, तो बने रहिए मेरे साथ में एंड तक। लेट्स स्टार्ट द क्लास। सो द टर्म शॉक is one of the emergency situation condition. Where you hear this term while practicing in the hospital or in your clinical duties, we run towards the patient and we try to back the patient in her normal condition as soon as possible. So always treat shock like this. It is an emergency condition. Okay, now we firstly discuss about the definition of shock. So let's discuss. So shock is defined as inadequate delivery of oxygen and nutrients to maintain normal tissue and circular function. So it means there is a imbalance between the demand and supply, or we can say it there is sheer imbalance demand between the demands and supply. Now what I am talking here, for example, what is the purpose of blood flow in your body? That blood is carrying important substance like oxygen and glucose, and that oxygen and glucose is delivered to the tissue of your body to maintain a normal function by your body. If that cannot be happen, then the condition is known as shock. Understand everyone? If the imbalance of your body demand and your body requires, then it will be the condition of shock. Next, shock becomes irreversible if not treated early. There are different classification of the shock. One of the classification of shock is compensation and compensated and decompensated shock. Now what do you understand by compensated? It means reversible. Compensated, it means reversible, or non-compensated, it means, or decompensated, it means probably it is irreversible. Okay, probably it is irreversible. Okay, so patient may come back again. Okay, but majority of them it may be die because of different complications. So shock becomes irreversible if not treated early. Remember one important sentence: your teacher never asked a definition of shock. Insufficient perfusion of tissue and cells. Most of the time it is associated with low cardiac output, but not always. Now next, what we discuss, shock is more than just tachycardia and hypotension we often see. It is much more than that, and these are some of the common clinical features: tachycardia and hypotension. We also see confusion in the patient. Okay, why confusion occur during this condition? Okay, anybody tell in the comment section why confusion occurs in that condition? Comment your answer. So this is because of hypoxia to the brain, because there is a decreasation of the oxygenation. Oxygen level is decreased. Also the blood flow to the brain is decreased supply of the glucose to the brain. All of these things should be happening at that condition. That's why brain got confused. Regarding the kidney, there may be acute renal failure. Now many different type of acute kidney failure. We were already made the video on acute kidney failure. The link is in description. But on this lecture also I am tell you a little bit about a kidney failure, because this is very important for you all. So first is known as pre-renal failure. Whenever there is a decreased blood flow towards the kidney are normals, but the blood flow towards the kidney is not going to normal, and that's why the kidney not get proper amount of blood, and that's why a condition occurs known as pre-renal failure. Understand everyone? If we treat the patient at the time, then there is no such condition like kidney failure. But if we are unable to provide treatment at the time, there is a definitely develop of the renal failure itself, and this is also known as intrinsic renal failure. Note it everyone. And also one term for this is ATN, acute tubular necrosis. And if this all our situation happens, there is an increasation in blood urea nitrogen and also serum creatine. They all are high in your bloodstream. So these are some features of abnormal kidney functions. Next, liver. So in a liver there is a abnormal liver function test, and this is due to the elevated of AST and ALT. Okay, anyone knows about the full form of AST and ALT? Just comment this full form on comment sections, guys. Okay, so AST, it means ALT means alanine, aminotransferase or transforminase. In some other they are also known as SGPT or SGOT. You all are introduced from these two words, SGPT and SGOT, I hope. Okay, and why your liver is affected due to shock? The answer is same. Because there is a decreased perfusion of the liver or towards your liver. Same things, liver is not able to getting a proper blood supply, and as a result there is a damage of your liver. Bilirubin can also be high. In that condition your bilirubin level is also be increased. Next is regarding your heart, your cardiovascular system, guys. There is a chest pain and shortness of breath. This occurs because of your heart failure. And if you talk about your blood, there is an increased lactic acid in your blood level. Okay, so all we discussed. Now once I will explain you about all this in short. So this is decreased tissue perfusion. What I am talking about here? What? Decreased tissue perfusion. Okay, and whenever there is a decreased tissue perfusion, there is a surely decreasation of your oxygen, and this decreasation of oxygen leads to anaerobic metabolism. Okay, what? Anaerobic metabolism. And in the end product of anaerobic metabolism is lactic acid. So this is how you can correlate with things. And so in the end, if all of this shock develop metabolic acidosis, this is the mechanism of, so this is the mechanism there. Okay, let's go for further notes. Okay, now we will discuss about pathophysiology and types of shock, that what types of shocks are there and what is their pathophysiology. So shock is described a state of imbalance between tissue substrate delivery supply and tissue separate consumption and demand. I already mentioned this important sentence about that. It's a clear cut imbalance of the cells are showing increased demand. Your body cells are showing that there is an increased demand of and decreased supply of blood. That is shocked. So we are medical students, so we have to know about that, how to perfusion and determine this tissue perfusion. Okay, we have to know about how to determine tissue perfusion. So for this, let's talk about some of the formula here, and also some of the important terms like cardiac output, stroke volume and heart rate. Next, systemic vascular resistance. Okay, now I will explain you about this. So cardiac output is equals to stroke volume and multiply by heart rate. Everyone of you know that. Everyone almost know this. Okay, now cardiac output is equals to stroke volume and multiply by heart rate. Okay, now let's talk about the blood pressure. Blood pressure is equals to CO into SVR. These are mostly interrelated to each other. So your blood pressure is equals to cardiac output and stroke volume or systemic vascular resistance, SVR, also known as peripheral vascular resistance. So these are same things, cardiac output multiplied by systemic vascular resistance. Now if your cardiac output is increased, then suddenly blood pressure is also increased. Okay, and if systemic vascular resistance is increased, blood pressure is also increased. So similarly, if cardiac output is decreased, there is a hypotension in blood pressure. If systolic blood vessels are dilated, then there is an increase in resistance in your blood pressure. Never ever forget this wonderful formula. Okay, you can easily answer if this type of question is asked. Now the question is how to calculate this systemic vascular resistance or peripheral vascular resistance. So this is done by calculating of main arterial blood pressure and central venous pressure. Okay, the central venous pressure we should be measured and it is divided by cardiac output. Now there is a one new term for you, mean arterial pressure. Now what is this mean arterial pressure? If anybody knows, they can comment their answers on comment section. This is a live class. If anyone knows, comment your answers, guys. Okay, anyone answers? Okay, now see this. So the mean arterial pressure is the main pressure which drives the blood flow inside your blood vessels, especially inside your blood vessels. So now we discuss about how to calculate mean arterial pressure. I will teach you about mean arterial pressure. Okay, now see here, this is mean arterial pressure I am talking about. MAP, it means mean arterial pressure, is equals to diastolic blood pressure, okay, plus 1/3 of the pulse pressure. Never forget this, diastolic blood pressure plus 1/3 of your pulse pressure. Okay, there is another term known as PP, it means pulse pressure. Now what is the pulse pressure? So your pulse pressure is, so the pulse pressure is the difference between the systolic blood pressure and the diastolic blood pressure. So systolic minus diastolic pressure is equals to, and diastolic blood pressure plus 1/3 of pulse pressure is known as mean arterial pulse pressure. So there is a one small problem is there. Let's solve the problem. Before solving the problem, if you are like the class, please hit the subscribe button and also like the class. So we solve it by taking an example. So let's see here, if a person systolic blood pressure is 130, okay, if a person has its blood pressure is 130 and it comes in millimeter of mercury, okay, millimeter of mercury, 1/3, it is systolic blood pressure. SBP, systolic blood pressure 130. And if the same person diastolic blood pressure is 80 millimeter of mercury. Can you all calculate the mean arterial pressure for this person now? If you can, comment your answer on comment section. Try to find out the mean arterial pressure of this person with the help of this formula. Okay, according to formula, mean arterial pressure is equals to diastolic blood pressure plus 1/3 of pulse pressure. So the diastolic blood pressure is 80 here, okay. Before that I should be to calculate pulse pressure, and the pulse pressure is systolic minus diastolic. So it comes 50. What? One third of the 50. We need to calculate it, okay. Now divide 50 by 3. It is somewhat 16. It comes 16 point something. What's your answer? It's my 16 point something. Now you have to add 80 with 16 point something. It will becomes 96. It will come 96.66. Okay, so that is the answer. Okay, similarly in different types of exam, this type of questions easily can ask to you. Even it will be asked on MCQ type of questions. So you have to remember this formula. By the help of this formula you can solve any of this type of answers. And this is called the driving pressure for your blood flow. Let's move on to another one. With the help of this concept, let's declassify the shock. Now the shock is classified into different types according to which of these factors are abnormal. So the classification is different in every different books. So what I am telling you there, you can also follow some other textbook answers, but what I have the content, I will explain you about it. So the main thing is that you should have to focus on concept, don't mug it up, okay. The development of the concept is important, so you will never forget it, and that is much important thing. Okay, now come to the topic. These are one of the very common classifications. The three major types of shock are hypovolemic, distributive shock And it also includes main three types of shock that are, which are septic shock, anaphylactic shock, and neurogenic shock. And all of these shock are known as distributive shock and one of the cardiogenic shock. Understand everyone? So these are three major type of shock, which are hypovolemic shock, distributive shock, and cardiogenic shocks. These three type of major type of shock. Okay, now what is distributive shock? This question must be coming on your all mind. So the distributive shock means the blood volume, okay, inside those blood vessels which are adequate or enough and sometimes more than the normal, but the blood is not present inside the arteries, and this blood is present towards the periphery, especially in the veins, or those arterial systems are dilated, the blood is collected there. It is not present in the main arterial system, and that can result in decreased tissue perfusion. Okay, so the distributive shock was of shock of dilation, and these types are septic shock, anaphylactic shock, and neurogenic shock. Understand everyone? Your cardiogenic shock is associated with your heart problems. That's why this term is known as cardiogenic. And hypovolemic is decreased blood volume. Now before we move on the topic, the first step in the treatment of any type of shock is control of airway and breathing, and next is restoring of circulation, that is also known as A, B and C. So you get a question about what is the connection of airway and breathing here. We were talking about the shock there, and the shock is all about circulation there, but I will give you some examples quickly. If a person brought to the hospital as a result of road traffic accident RTA or fall from the height, the person majorly have a bleeding when you examine the person. But in any condition, by chance you forget to examine the airway of the patient and breathing, and you completely focus on the bleeding, the person maybe die, because you only focus on the bleeding outside you see by your naked eyes, because there may be a chance of airway compromise. You were very happy that I was stopped the bleeding, but you didn't notice about the airway of a patient. And when you call the patient is not answering because the patient is already dead, because you didn't pay attention to the airway and breathing, that patient is able to take proper breath or not. So all the time in very sick patient in emergency, quickly examine the airway of a patient, make sure that an airway is normal or not, breathing is fine. Don't only focus on the circulation. But if the patient is not sick, a patient is nice, he is able to talking, patient is sitting in front of you and he is talking with you, or a patient walking around, he is able to walking also, so then don't answer like this. I will tell you about A, B and C for your examination. That is not necessary at that condition. The important is which condition the patient is there. This ABC algorithm is important only when the patient is unconscious or very severe type of cases. So before we move further, let's talk about some of the very, very important points once again. So the first one point is think ABC with any patient in shock, secure airway, breathing and circulation. So students, we know more about how to check patient airway. So right now we talk about it. So I want to ask you a question with you all. How to check airway? Anyone can answer how to check airway? Now anyone can answer that how to secure airway? How can we secure airway of a patient at that time? Any suggestion? Any comments? How to secure a patient airway, students? So this is one of the tough and not an easy question. I will told you about this. So airway can be secured by different means. One of and important is position of the patient, that what position should patient taken, or what position you should have to give to the patient for proper secure of the airway. and the position is required is lateral. In that condition, never place the patient in supine position, okay? Because when you put the patient in supine position, then at that time the tongue may fall back, especially in a Tomeko case, and the tongue itself may block the airway of a patient, and at that time you make more difficulty to the patient. But if the patient is let the patient on lateral position, there is a less chance of tongue fall back, okay? The tongue may be fall of the side in sideway, and at that time the airway is still secure. This is one of the easy way to shock secure airway. If there is some of foreign body in the mouth of a patient, there may be sometimes there is a chance to be foreign bodies placed in the mouth of a patient. Quickly remove that. If there is some of fomites, quickly remove it. Quickly suck it out and clean whole oral cavity of a patient. If something is there in the mouth or is oral cavity, this is another secure way. So after positioning, this is all about positioning. And after the positioning, ET tube. What is the full form ET tube? Anyone can answer it? Next is ET tube intubation. Now this tracheal intubation tube should be done if a patient is not protect his or her airway, especially in a case of Tomato's case. And there is a two type of intro tube are ET tube are. There is a two type of ET tubes. One is called curved tube and another is called uncurved tube. Curved and uncurved. Now to secure the airway, we put curved tube. Curve, it means there is a balloon. We inflate balloon, and after that nothing can go distally from the balloon part. Okay, so this is a very good way. Now next one is to secure breathing. Firstly, you have to make sure that a person is able to breathe or not. It is very important to make sure about the person itself can breathe or not. Then if he is able to take a breath, you have to count the breath rate. But if the patient is not breathing, then you have to give artificial respiration. That is begging. You all know about that ambu bag, known as ambu begging in the hospital. And if there is not patient in the hospital, if there is outside of the hospital, there is a mouth to mouth breathing. This is how we can secure a breathing, and oxygen also is a part of breathing. So we give oxygen supplies to the patient in case of breathing. It's not come in airway, it's come in breathing. Okay. Next, circulation is examination of a pulse, examination of blood pressure, okay, capillary filtering time, and maintain it by giving IV fluid. So this is all about the airway, circulation and breathing. Everyone got it? So this is an important knowledge. If you write in the beginning, if you know about it, it is very helpful for you. So before moving to next, I request everyone hit the subscribe to my channel and also like to the class. Or you may also invite your friends or other medical students to attend the class. Now next one is shock and trauma or post-operative patient is assumed to be hypovolemic until proven otherwise. Because both of these cases must probably occurs because of the excessive bleeding. Trauma bleeding is very common in post-operative patient as a result of the injury to the tissues. As a result, injuries to the blood vessels. The patient may bleed excessively, so we presume this as a hemorrhage or also known as hypovolemic shock until proven otherwise. Now another important knowledge is if the skin is warm, it is distributive shock. Now question in your mind is why the skin is warm in distributive shock? What is the mechanism of it? So this is because of vasodilation, because there is a good amount of blood flow still in the peripheral. Then when we touch or examine the peripheral part, for example hands and the feet of a examination patient, they are still warm and their skin is also warm. All three type of distributive shock having this type of thing. Similarly, on the other hand, if the skin is cold and clammy means sweaty, then it is hypovolemic or cardiogenic shock, where the peripheral vasoconstriction occur. This Remember this vasoconstriction is the cause of cold skin and clammy. Clammy means sweaty type. Next, shock with bradycardia is neurogenic unless proved otherwise. Now, every one of you know what is bradycardia? Decreased heartbeat. When your heartbeat has slow or decrease, it is known as bradycardia. Now, what is the mechanism of bradycardia in neurogenic shock? Is anyone can answer this? So, your neurogenic shock is all about the damage of sympathetic fibers or a sympathetic nervous system. And I hope you all know what is the function of sympathetic nervous system. It increases the heart rate. On the other hand, the parasympathetic nervous system is not affected. So the bradycardia is very common in neurogenic shock. Everyone got it? Apart from that, all other shock having tachycardia in the beginning. Never forget this. Later on, in a decompensation phase, when a patient is about to die, during that time, the tachycardia may convert into bradycardia itself, and this is a very, very serious stage, and there is a probability of lose the patient if that condition comes. So for the practical purposes, all student remember that tachycardia is a feature of all other types of shock except neurogenic one. Okay, so these are some of important points for us. Now let's move further. So we discussed some of other classification mentioned in some of other books. Everyone just discuss a little bit about this. So this is by different author or different teachers. These 4 major types of shock. Now on this type of shock, obstructive shock has been added. Now on some other, this obstructive shock is a cardiogenic shock itself. Obstructive shock is a cardiogenic shock itself. So this is a different from previous because these are given by different authors. We don't worry about this. Whatever answer you will give in the exam will be correct. Okay. So what do you mean by hypovolemic? Lack of blood or fluid. And hemorrhagic is a most common type, especially in the surgeries. But in a medicine patient, there are some of other causes of hypovolemic shock, like diarrhea and vomiting. Means a severe type of diarrhea and vomiting. It is a very, very common cause. Burns is another important cause in surgical patient. Now what is obstructive? Obstructive is some type of obstruction. What do you mean by obstructions? When there is some of obstruction are there in your cardiovascular system. The few of example are there. I mentioned that everyone have clear that. What is cardiac tamponade? Can also known as cardiac tamponade. Okay, cardiac tamponade or pericardial tamponade. It means there is a collection of blood in the pericardial cavity which is giving compression to the heart. So there is a lot of problems in refilling phase, and it is a type of obstruction. Second one is pulmonary embolism. Okay, what is pulmonary embolism? This is also we can consider as a type of obstruction. Third one is a tension pneumothorax. Okay, what? Tension pneumothorax. And now what is pneumothorax? I think many of you know about pneumothorax. It means collection of free air in your pleural cavity is called pneumothorax. Okay, collection of free airs in your pleural cavity is known as pneumothorax. If that air under the lot of pressure, then we called it as a tension pneumothorax. Everyone got it? A tension means a pressure there. Okay. Next one is distributive shock. Students know it already. There is inadequate distribution of a blood. Most of the blood is distributed between the peripheral part as a result of vasodilation. And next is neurogenic and vasogenic phase shock, and another one is anaphylactic, and last one is septic. Are some of types. Okay, septic is due to the infections. Anaphylactic, it is because of allergic reactions. It is a type of hypersensitivity react. And one of is neurogenic. It is due to the blockage or damage of sympathetic neurons. Now next one is cardiogenic. In this condition, the heart inability to supply adequate blood supply It means your heart has some problem. That's why the heart is unable to supply in a adequate blood supply to the tissue. Okay. Now anyone can tell me some causes of cardiogenic shock? Anyone? So the perfect example for this is myocardial infarction. This is a perfect example for this condition. Okay, got it everyone? Or acute myocardial infarction. And this is a very common cause of cardiogenic shock. One more cause is there, is known as arrhythmia. Absolutely, like arrhythmia, like ventricular fibrillation or ventricular tachycardia. Okay, and those type of conditions. Some other type of serious heart disease can also be taken example of cardiogenic shock. Okay, like cardiac trauma, like cardiomyopathy. And there is a certain difference between cardiogenic and heart failure. They both are not same actually, they have different. A heart failure is almost like a cardiogenic shock, but heart failure means the heart is still in working condition but in a lesser amount than previous. In that condition, a person can still do a regular type of some works. There are many different grades of heart failure. Okay, in grade 4, heart is very serious, almost looks like cardiogenic shock in grade 4. But cardiogenic shock is very severe condition where your blood pressure is very low. Now, if someone has been asked you that what is the difference between congestive heart failure or cardiogenic shock, do not get scared of this question. Okay, the answer is very easy. You can say heart failure is a congestive heart failure is a minor type of cardiogenic shock, whereas cardiogenic shock is very serious condition where the heart cannot pump enough blood so that severe type of decrease tissue perfusion. Okay, so these are some important and major type of shocks. Okay, now let's move on to the another. Before moving on to another, I extremely request you all to subscribe my channel and also share this link to your friends or your medicos. With this discussion, let's start discussion about the hypovolemic shock. Now we will talk about what is hypovolemic shock. So hypovolemic shock is most a common type of shock in your clinical duties. So there is a decreased tissue perfusion secondary to rapid volume blood loss. So hypovolemic shock is most common shock. In surgery, the most common type of shock is bleeding or hemorrhage, and that bleeding and hemorrhage is caused by trauma and a result of operation and surgery as well. Now let's move on to the topic. So decreased tissue perfusion secondary to rapid volume blood loss and preload. I'm sure you all know the meaning of preload. Anyone has known about the preload? So this preload is directly depend on what amount of blood volume in patient. Okay, what is the venous return in the patient. So this is called preload. Okay, so in a hypovolemic shock, the cardiac output is consistently decreased. Okay, as a result of hypovolemic shock, the tissue perfusion is compromised. Okay, and that's why the cardiac output is consistently decreased. Now the causes include bleeding, vomiting, diarrhea, third spacing. For example of this is like a burns and bowel obstruction. Also pancreatitis. Okay, burns, it means a different cause of losing your body fluid. Okay, next, third special loss specifically means the fluid is still present inside our body but not in the proper place. For example, there is a leakage of the fluid in the surrounding area, or if there is a collection of the fluid in the lumen of a bowel or in the intestines. What's the use of that fluid? It is already come out from our blood vessels, but it is not come out from the body. So this type of loss is called as third space loss. Got it everyone? Next, pancreatitis is one of the good example for this. In the burns usually there is a evaporation of a fluid. The fluid is directly lost outside of the body. Next is most common cause in surgical or trauma patient is hemorrhagic shock, excessive hemorrhage or bleeding. So I will show you some of causes of hypovolemic shock. If in any exam this type of question is asked, write the causes of hypovolemic shock, every student should to write the answer. Okay, so we discuss quickly. First is severe burns, excessive diarrhea, excessive and vomiting, excessive sweating as well. These are some of important medical and surgical causes. Okay, now add another important is excessive hemorrhage and bleeding from trauma like road traffic accident and major bone fractures, isn't it? Or one of these important is internal bleeding. Don't forget this point, the internal bleeding. For example, if a person is fall from a height 5th story building, that person may ruptured liver as well as spleen. Liver or spleen are a highly vascular organ. If they both are ruptured, there is a severe type of bleeding in the peritoneal cavity, and that can be result in hypovolemic shock. So all these are some of the causes. So everyone pay attention here. These are some of the hypovolemic shock causes. As you can see on picture, some rare type of causes are also highlighted here. First one is hemorrhage. This is very common cause for hypovolemic shock. Next one is plasma loss through burns and decreased body fluid. Already talked about it. As a result of bleeding, vomiting, diarrhea also are included there. Some other cause also may be diabetes insipidus. Now anyone knows about diabetes insipidus? If you know, comment your answer on comment section. So this is very new term for you all, diabetes insipidus. So let me answer about this. So the diabetes insipidus is associated with ADH. It means antidiuretic hormone. Okay, and your ADH, anterior diuretic hormone, is released by post pituitary gland, and where it is secreted from your hypothalamus. Okay, so it is coming from a posterior pituitary gland, and the function of this is the retention of the water, especially from a collecting duct. And if this ADH is increased, that's what happens in diabetes insipidus. Then water cannot be retained in the body, and the water is excreted excessively in a urine, which leads to very dilated type of urine. Okay, and because of this we lose very much fluid from our body in the form of urine, and resulting in a hypovolemic shock. Okay, so this is the reason for diabetes insipidus, reason mentioned here. Now diabetes insipidus, everybody knows, is a condition of hypervolemia, and because of decreased insulin, either absolutely decrease or. Now in diabetes mellitus, because of the passage of glucose in the urine, that glucose will drop fluid along with it, and patient will be hypovolemic. So both type of diabetes are the hypovolemic condition. Diabetes mellitus, very common disorder associated with insulin, and also diabetes insipidus, it is associated with ADH. There is a two form of diabetes insipidus. One is called central, another one is peripheral. So let me write there quickly for you, central and peripheral. Central diabetes insipidus is lack of secretion. So central diabetes insipidus, lack of ADH secretion, and peripheral is resistance of that ADH in a renal tubules. Okay, after this another cause is diuresis. Now what do you mean by diuresis? So excessive diuresis. For example, we given powerful diuretic drugs like loop diuretic, that can also result in increases fluid volume. Now next we discuss how to make diagnosis. So it is very nicely mentioned here. Watch for increased systemic vascular resistance, poor skin, turgor, thirst, oliguria, low systemic and pulmonary preloads, and repeat heart rates. And this result of increases vasoconstriction, which is very common in hypovolemic. In hypovolemic situation, increase vascular resistance and it is a result of vasoconstriction. Okay, is a result of vasoconstriction, and it is very common in hypovolemic. What happened in this situation? Increased vascular resistance, and it is a result of vasoconstriction. There is also poor skin turgor. Now, skin turgor means the skin elasticity in a good, or we can say in a normal people, or those who have good hydration status, means they have good hydration status. If I pull the skin manually from the anterior abdominal wall, the skin will quickly go back in no time, within 1 to 2 seconds, and even lesser than that time the skin will go back. But in case of severely dehydrated people, if I do the same thing or a test, at that time their skin takes a longer time to go back. This is called poor skin turgor or a poor skin elasticity. Got it, everyone? This is a very important feature of severe hydration. Next is thirst, important feature of dehydration again. As a result of severe vomiting and diarrhea, dehydration occur, and that can be the result of hypovolemic shock. Next is oliguria. What did you understand by oliguria? I hope many of you know about this word and you are familiar to this word oliguria. Because answer your comment. What do you mean by oliguria? Anyone can answer about this question? What is oliguria? Okay, I will tell. Oliguria means less than normal urine output per day. Okay, when your urine output has been decreased, then it means you have oliguria. Understand? Got it? In some of textbook it is mentioned as a less than 500 ml, and in rare some of books it is less than 400 ml also. You can follow any of them, but the meaning is less urine output than normal. Okay, now that happens because of decreased renal perfusion in a case of hypovolemia, and there is also decreased blood flow towards the kidney, so decreased amount of urine production. This is very easy type of concept. Next, low systemic and pulmonary preload. What do you mean by this? This is very easy thing for you. Load is decreased because fluid itself is low, and there is also rapid heart rate, always present in the case of hypovolemic. Heart rate is always fast and the volume of pulse rate is low. Next, diagnosis is made after a loss of 15% intravascular volume. Okay, let's move on. Next, we are talking about the sign and symptoms of hypovolemic shock. So everyone please pay attention here, it is very important. Before I request subscribe and share the link of the class so many of your friends are joining the class. So these are some of hypovolemic shock sign and symptoms which are very common. First is early on patient will have tachycardia. Everyone has noted tachycardia, it means. Comment your answer in comment section. And also have hypotension and cool skin. But there is a hypotension condition is different from other, and this condition is known as orthostatic hypotension. Now, what do you mean by orthostatic hypotension? So the orthostatic hypotension means when we stand and if we become dizzy, and at that time our blood pressure is low only during standing, only when we stand our blood pressure has been low, then this condition is called orthostatic hypotension. When you stand and your blood pressure is low at only that time when you stand, then this condition known as orthostatic hypotension. Got it, everyone? And this can be considered as an earlier feature of hypovolemic shock. And your skin becomes cool as well as clammy. We discussed it previous. Now next is, as the condition progresses, they are hypotensive. They also have decreased blood pressure, become confused, and have cold clammy skin due to clamping down of peripheral vessels by increased sympathetic tone. This line are already explained very nicely. Now let us discuss something about this. Now, why there is a decreased pulse pressure? A question comes in your mind, why pulse pressure have decreased in hypovolemic shock? So let me explain this, why pulse pressure has been decreased. So let me remind you, pulse pressure is equal to the difference of systolic blood pressure minus diastolic blood pressure. Okay, systolic blood pressure minus diastolic blood pressure. Now in this condition, hypovolemic, the systolic blood pressure already decreases, but diastolic blood pressure is relatively increased, and as a result of vasoconstriction, here since systemic nervous system is activated, there is a peripheral vasoconstriction. There is increased pressure for the heart to push the blood inside the blood vessel, so the diastolic blood pressure is maintained and the systolic blood pressure is fall down. So if we consider these 2 points, then the pulse pressure will decrease. It is not increase, it is decrease. In a normal person, what is the pulse pressure? Comment everyone. If you take an example of 120 systolic and 80 diastolic, so what is the pulse pressure now? 40. But if it is lesser than 40, so if it is lesser than 40, it means it is so it is known as decreased pulse pressure. If it's increased, it is known as increased pulse pressure. If so, systolic blood pressure is increased and diastolic blood pressure is still same or maybe slightly increased, so pulse pressure is definitely decreased, which is the hallmark of hypovolemic shock. Got it everyone? So often vital organ, the first casualty of hypovolemic or cardiogenic shock, both cold shocks, are the kidneys, as blood is sent away from the constricted renal arteries. Therefore, it is crucial to monitor for renal failure. An adequate urine output is one of the crucial signs that the treatment is adequate. So, the vital organs, the first casualty of hypovolemic or cardiogenic shock, both cold shocks. So, both are result of peripheral both are cold shocks as a result of peripheral vasoconstriction. Okay, got it? Are the kidneys. Next, as blood is shunted away from the constricted renal artery. Therefore, it is crucial to monitor renal failure, and adequate urine output is one of the crucial that the treatment is adequate. Okay. Now, kidney is not considered as a vital organ here. Okay, kidney not taken like that. Okay, kidney is one of the very important organ, but not the vital organ, because vital organ means even there is a very less amount of blood volume in our body, some of the organs will be given preference to get that blood flow, like brain, heart and your adrenal gland. These three are really important vital organs. Even if no other organs in the body not receiving blood, brain is getting that, heart is getting back, and adrenal gland is getting it. Kidney, they don't get blood in a case of hypovolemic shock or situation. As a result of this, kidneys are clamped down. Kidney failure will occur in the beginning. In the beginning, it is a pre-renal failure. If you do not denial, then pre-renal failure is converted into intrinsic renal failure or acute necrosis. Now, because of this single important mechanism, if a person is still passing good amount of urine, we believe kidneys are not damaged. It means kidney failure has not occurred. That's why the history of decreased urine output has to be asked to the patient. And when the patient is admitted to the hospital, you should always collect how much urine is passing or check there is a oliguria or not. Okay, now we move on next one. So everyone just pay attention, this is important for you all. Clinical picture of a patient in hypovolemic shock. When there is a hypovolemic shock condition, how we keep patient, everything we discuss in this slide. Okay, so pay attention here, and not subscribe to the channel, hit the subscribe button and also like the class. So firstly, everyone just focusly with concentration, just look this slide, look at all of these images, pay attention here carefully. Firstly look all these images and then we will discuss. So first of all, we do a quick revision of what we studied in previous in this slide. Okay, then you will get better understand the topic. So there is a altered mental status in a case of shock. We are talking about hypovolemic shock for the time being, and this is because of decreased brain perfusion. So the person may be restless in the beginning. A person become a restlessness and also disoriented. Later on, a person may be comatose if a brain functions are severely tempered. Tachycardia is a very important feature of hypovolemia or hypovolemic shock. In the later stage of hypovolemic shock, there is a hypotension. Each and every students have know about the definition and meaning of hypotension. Now you all know that the hypotension means decreasation of your blood pressure, but what is the limit of it? Decrease then how much? What is one of the limit to decrease blood pressure is called hypotension? Yes, anyone can know about it? Anyone? So the level is 90. 90 is a level of hypotension. 90 is the lowest of that for hypotension. Now hypotension will associate with some symptoms and sign. If the person is dizzy, there is a tachycardia. Other signs like cold periphery, dizzy person or disoriented person. All these along with blood pressure, decreased blood pressure, that means systolic blood pressure is less than 90, is called hypotension. Got it everyone? Now next there is a dyspnea. Now many of you know about this dyspnea. This occurs especially when a person have any kind of hemorrhage or loss of bleeding, which occurs anemia, and anemia leads to dyspnea. Where is the explanation? What is dyspnea? So anemia is leads to dyspnea. Okay. Next, cool and clammy skin due to blood loss as a result of decreased blood flow there. Number 1 and number 2, vasoconstriction, and number 3, the clammy and stretchy type of palm skin as a result of sympathetic stimulation. Next, ongoing bleeding can be seen. Observe there how much urine is passing from patient, and that can be done by inserting Foley catheter. Now, Foley's catheter is a type of self-retaining catheter. When we insert it into the urinary catheter, Foley's catheter is a type of self-retaining catheter. When we insert it into the urinary bladder, there is a balloon and will inflate that balloon, so it will be remain in the place. Even if patient try to pull it out, it doesn't come because of the balloon there, and this is called Foley's catheter. So when we look at the Foley's catheter of a patient, if there is a good amount of urine, you will be very happy in this type of people. But the urine output is less, probably the patient has already developed the renal failure. Got it? And regarding the treatments here, there is a 2 important therapy are there. One is IV fluid replacement, as can you see in the picture. This is the crystal vial in the beginning, like normal saline or lactate ringle, and if they do not reverse all the hemodynamic, all the signs, and the blood transfusion has been done. Blood transfusion is very necessary in a case of blood hemorrhage, because there is a lot of bleeding and the blood loss from the patient's body. To recover this blood, you just do it the blood transfusion. Got it everyone? So this is an important slide where we discuss about the clinical features. I hope you will get it all the information from the pictures, and by theoretically you will be get some of knowledge by my side. Let's move on. Next, now if hypovolemic shock is due to the bleeding, what is the treatment? In the beginning, if there is a hemorrhage shock, what is the first treatment? Can anyone tell? Okay, so now some of you have questioned that we can give blood transfusion. No, in the beginning you have not to give blood transfusion. In the beginning you have to start it from IV fluid. Got it? Or whenever you giving IV fluid to the patient, that time take a bit of blood from the patient and send for blood grouping to know that what is the group of that blood, to know that what is the blood group of that patient, and then find out the donor. This will help to find out the blood at time for the patient, or arrange the blood at the time of patient. Okay, let's move on to another topic, that is hypovolemic shock treatment. That what are the treatments should be given to the patient of hypovolemic shock. So first of all we discuss about, so remember what we have in the condition of hypovolemic, lack of fluid in the body. So what is the treatment for it? Firstly, so in the beginning we always use crystalloids. We always use crystalloids in the beginning. From the last classes we have to talking about this. See, crystalloids, normal saline or lactated ringer, they both are the known as crystalloids. This normal saline has 0.9% of normal saline, okay? And in the beginning, we need to give this fluid very rapidly. Rapid resuscitation, and that is done by 2 large bore peripheral IVs is best for volume repletion. It is usually, both upper limb in the antecubital fossa. So let me tell you an important point for you. We have an important vein which is called medial cubital vein. Got it, everyone? In antecubital fossa. Okay, these are the veins which are very commonly used for cannulization, and in that condition we need to cannulate both the side, left as well as right, and also gives the fluid very fast. Next point is the adequate resuscitation required 3 to 4 ml of fluid for each 1 ml of seed blood. This is another point we have to understand. Pay your attention here. Now let's talk about this. If a person having a bleeding, if a person already has blood, 1 liter of a blood, if I want to resuscitate that person nicely, I need to give 3 times more crystallite. That means 3 liter of the fluid have been given if only 1 liter of the blood lost. Now the reason behind of this is only 1/3 of crystalloids is stay in the intravascular compartment. Got it? Other we dissipated outside in the extravascular compartment. Okay, only 1/3 of the crystalloids will stay inside the intravascular compartment, and that intravascular fluid should be rise in case of hypovolemic shock. Got it? That's why we need to give almost 3 to 4 times the blood loss. Got it, everyone? I hope you all understand better. If you are not understanding, pay attention here. Now let's talk about something more. Out of those, after those important crystalloids we have one we give. So in the beginning we can easily use the normal saline, no doubt about it. But if the large amount of or large volume of normal saline is given, the person may suffer from hyperchloremic acidosis. Got it? Now what do you mean by hyperchloremia? Anyone knows about it? Give your answer in comment sections. Hyperchloremic or hyperchloremia. Okay, it means increased chloride or increased chlorine. So in normal saline, high amount of chlorine, high amount of chloride. So that chloride will lead to metabolic acidosis, and that is itself known as hyperchloremic acidosis. So let me explain this mechanism very quickly. So chloride and bicarbonate, these both are anions, and these are negatively charged ions. Now these anions compete with each other to maintain the concentration of the ions in the fluid, and they always compete with each other. So what is the meaning here? Here we are giving a lot of chloride from outside, so this chloride will push the bicarbonate inside the cells, and it will push bicarbonate into the cells. Now what will happen in the bicarbonate level in the blood? Now it will be decreased, and it will cause decreased level of bicarbonate, and that is called metabolic acidosis. Now if you go back, when you defined metabolic acidosis is all about the decreasation of bicarbonate. So we are having decreased level of bicarbonate in the blood as a result of pushing the bicarbonate into the cells because of excessive level of chloride, and this is called hyperchloremic acidosis. So we call the situation linger lactate is a preferred choice, then normal saline in case large volume resuscitation. Next, move on. If a person lost his lot of blood, then you have to replace the blood, but the replacement of the blood is not that much easy. You need to make sure that the blood is available, and we need to do 2 things here. Firstly, we have to blood grouping of the patient right there in the hospital, and the second is a cross matching of a blood, and make sure the blood is ready there. Then only in condition you can transfuse the blood. Another treatment is treat the underlying cause. For example, if a spleen has ruptured, if a liver has ruptured, and that has caused hypervolemic shock, you need to go surgical correction. Probably splenectomy should be done. Next, if there is a failure to respond to fluid resuscitation even after giving a large amount of fluid, then you can think about this patient having necessity of bleeding from somewhere. That's why our treatment is very ineffective. We have done a good treatment here. We were given a good amount of fluid. But why the patient is not improving? Probably this patient is continuously bleeding from somewhere else. So firstly you have to find out where the bleeding is occur and then go for the emergent surgical procedure. That means surgery. You go for surgical management that time. And it depends on the cause actually. What is the cause of the hypervolemic shock? So accordingly those surgeries have been chosen. Now everyone just attention to this picture shown in the slide. Is anybody knows what is this position and what is the name of this position? So name of this position is head low position or leg up position, or in the medical term we call it Trendelenburg position. Trendelenburg position, okay? And this position is all about head low and the leg high at feet. This position is given when somebody have orthostatic hypertension or this type of shock. And now why this position given to the patient at that time? Because to increase the blood flow towards your brain. Understand? This position should be given because for increases blood flow towards your brain, and this position should be advised for the patient. Okay students, this class is gone so lengthy, so we come on end of this hypovolemic shock. Let's discuss this. This is live class started today. Now also you can invite your friends, either you can share it after the live section. So some of the important points in the end. Tachycardia is first symptoms in hypovolemic shock. Factors that suppress the tachycardia response to hypovolemia. So never ever ignore your tachycardia. This is a vital sign for hypovolemic shock. What is the rate of the pulse at that condition? Or what is the volume of the pulse? In this case the volume is low and the rate is high. Got it? But sometimes patient may not have been tachycardia. So what are those conditions? See here. So these are the factors that suppress the tachycardia response to hypovolemia. For example, beta blockers. Is anyone knows the examples of beta blockers? So example is propranolol. Next, atenolol, labetalol. These are some of the example of beta blockers. And these beta blockers causes bradycardia. Got it? If beta blockers consistency causing bradycardia, in that case the tachycardia response, so the tachycardia response will be there. Next is athletes. So this is a very important cause. Athletes, it is the cause of physiological bradycardia, because the muscle mass for this is high for profit and they can maintain good stroke volume without raising the heart rate. So didn't need enough heart rate for the ejection of same amount of blood. That's why they are usually bradycardic. So if this, probably the amount of tachycardia would not be there. So another one, in case of spinal shock or also in case of neurogenic shock or damage of the sympathetic neurons or spinal cord, there would be bradycardia. One more point is there, never use dextrose containing solution for resuscitation. Probably I will already explain this, that always use crystalloids. Dextrose containing fluid is not a crystalloid, and this dextrose never stay inside the intravascular compartment. It will quickly dissipate outside and interact with the cell. But what we want in the hypovolemic shock is whatever fluid we given, it should be stay in the intravascular compartment. That's why dextrose containing solution for resuscitation is not used for resuscitation. So we are completing the discussion on hypovolemic shock. Next shocks we discuss in later classes. This class we have to close now. It is already lengthy class. If you are like the class, हिट द लाइक बटन एंड नॉट फॉरगेट टू। ये था हमारा आज का टॉपिक जो कि हमने अच्छे से डिस्कस करा है। अगर इससे रिलेटेड आपको कोई भी क्वेरी और डाउट हो तो आप कमेंट सेक्शन में कमेंट डालकर पूछ सकते हो। और चैनल को सब्सक्राइब करें, चैनल को सब्सक्राइब करें और वीडियो को लाइक करें। थैंक यू, हैव अ गुड डे।